do want to do that. There we
Great.
go. Now we got it. All right. So again, my apologies to you.
You don't need to
Um,
apologize. It's all good. I'm
so
awake still, so it's fine.
all right. So we'll get started here. So let me do my intro here. All right.
Take your mind into the wonderful world of physical, emotional, psychological, and spiritual wellness. Ladies and gentlemen, welcome to the Kinetic Hour. Conversations with you and guests. With your host, Kenan Wesley Mason.
Good morning, good afternoon, and good evening, and welcome to another edition of the Kinetic Hour. I am your host, Kenan Wesley Mason. Welcome one, welcome all. As we are streaming on Zoom today, as we've had a little technical difficulty. So for everyone watching this, you're going to be watching this after post-production because we had some technical difficulty with StreamYard. So for this go-round, there won't be any simulcasting from Facebook and Instagram and LinkedIn. But after post-production, I'll make sure that I provide the final product and link you all to the final product on all three platforms. So for everyone watching this, thank you anyway for tuning in, as this will be on YouTube. For everyone listening, again, as always, go to my YouTube channels. There's always two. One is right here, the Kinetic Hour, and that's Kinetic, Kennetic, the Kinetic Hour, and the other is Kinetic Fit and Wellness Info. Kinetic Fit and Wellness Info for everything physical health, mental health, emotional health, spiritual health. So again, thank you all for tuning in. As I always say, whether it's one person listening or watching or 1,000 people watching, my voice will continue to permeate. So thank you all for tuning in. It's greatly appreciated. Tell everyone you know to subscribe, click the thumbs up, click the notifications, tell everyone that you know to leave comments and leave comments regarding the comments so we can continue in the YouTube algorithms. So as you see above me, my guest today, and I'm glad she's here as we go international across the Atlantic Ocean again. And I'm going to read her bio here. She's a family, clinical, and holistic physician, mother, singer, speaker. She's the clinical director and founder of Scotland's first truly integrative general practice. She's the founder of Singing Health, founding member of Inner Health Coalition, a medical doctor combining alternative healing to give each client a holistic experience to further their health goals. Her clinic is the only facility of its kind that offers an integrative approach to healing all under one roof. And she brings a special modality of singing to her practice. And we're going to talk about all that and much more. Ladies and gentlemen, please welcome Dr. Veronica McBurnie. Dr. B,
Hi
thank you
there.
so much for joining the Kinetic Hour. And thank you for taking the time out because I know it's getting later and later over there. So thank you for gracing the stage with me today.
You're so very welcome. Thank you so much for asking me to be with you. I'm looking forward to this hour together.
Absolutely. Thank you so much. Um, we have a lot to get to, and I got a bunch of notes here that I've taken down. But the first thing where I want to go is your journey on how you got started going into the uh, clinical field of health and then transitioning into the alternative way of health and then combining the two. So, what was your journey and what was the starting point of you even going into this field of practice?
Okay, that's a good question. I grew up in Glasgow, the daughter of a dentist and a teacher who had very humble backgrounds and were really had to work hard to carve out a professional career. And when I was at school, I was torn between a career in the medical field and a career in singing because singing is very close to my heart. We can discuss that later.
Yes,
So,
absolutely.
little did I know that the paths would naturally come together. But ultimately, when I left school, I went to Glasgow University and I studied medicine. And right from the get-go, I was always interested in what helped people heal. Why did some people heal quicker than others? Why was somebody gone in 3 weeks after a diagnosis of whatever? And why did someone else last for 5 years? And why do people react so differently to disease? And Glasgow has a lot of areas of poverty. And I was very passionate about working in those areas and learning about health and disease throughout my career there. I've also traveled around the world extensively and looked at how different nations heal, how different cultures heal. It's not always about Western medicine. So I've had many great teachers along the way, and here I am now with my own clinic. Very excited to be there. We've been open for 4 years now, so
Nice.
yeah,
Nice.
finally got there.
Yeah, you finally got there, and I love the layout of your facility, which we'll get into a little later. And you're all the way in Scotland, Glasgow, is that
I
right?
am sunny
Glasgow,
Scotland. Yeah,
sunny
and
Scotland.
it was sunny today actually.
Okay.
Contrary to what everyone says about the weather in Scotland, it's a bit of a secret. The nice days are secret, but they're there.
Yeah.
So we have the sunshine today, and all the planets are lining up in the next 24 hours. So it's going to be fun. Uh,
Yes. Check
yeah,
that out.
starry skies. Yeah.
Yeah, yeah, all the planets are lining up, obviously, because we're here, you know. Um, what made you go into what made you go more into the holistic route after you went the clinical route? What made you go holistic or alternative? What did you see that told you that I might want to try something a little different?
Well, the two don't have to be separate. Medicine is about the whole person and it's about learning from all cultures, all beliefs, and all ways of practicing healing. The art of Western medicine perhaps isn't always a match with the word healing, but I had many teachers along the way. I had a journey of ill health myself.
Okay.
So I had to kind of carve out, early in my career, I had a spinal injury. And I spent a lot of time lying, doing nothing in hospital. I wasn't able to move. So I learned a lot about being patient, about empathy, about healing. And I read a lot about how people heal and what makes people heal from the inside out. And,
Yeah.
I was always interested in the brain and the mind-body connection and how we talk to ourselves and how important that is. So I guess I was always seeking. And I spoke to so many wonderful teachers and learned from so many wonderful teachers over the years that
Mhm.
I collated all the information that I've been given and I use it in my practice. And I'm quite experienced now. I've been practicing for decades,
Yeah.
and
Yeah.
I am lucky enough to have held in some of the wisdom from all these great teachers I've had, and from all the journeys I've had. I've worked with Maasai people in Kenya. I've worked on yachts in Bermuda. I've worked in the prison in the heart of Glasgow. So, I've been around. I've worked in
Yeah.
Nepal in the mountains where we had very little equipment, but there was a lot of great work we could do. So, it's a learning journey and it hasn't stopped.
Yeah, yeah, and it's good that you've taken kind of a global approach because there are so many different types of modalities, which is why I'm so fascinated. And I went into different parts of holistic healing, not as traveled. I've been to Mexico City and I've been to the pyramids, and which was a great experience. Um, and then learning about natural health was really eye opening for me because here in the Western world, we're still kind of not so enthused about going the alternative route when it comes to healing. Um, I don't know how it is in other parts of the world or even in Scotland. Um, why do you believe that so many people are so hesitant to go the holistic route as opposed to the conventional allopathic route of healing?
Well, that's a good question. I mean, people go with what they know. So if you grow up in Western society and you learn that this happens and you go to hospital for that and you take a pill for this and you take a pill for that, then that's what you know, that's your culture. So there's natural suspicion about other ways of healing. And I would like to break down some of these barriers and share with people that there are so many ways. It's not one or the other. You know, you can form a bridge and the two can work together. I
Yeah.
still prescribe medication when it's needed. I still order MRI scans and CT scans when they're needed. But I also look at the whole person as an individual. And, you know, we're all completely unique. Every one of us is completely unique. So, how can our response to healing and our wellness be compared to the person next to us? I
Hmm.
mean, evidence-based medicine is important. It has a role, but it's not everything.
Yeah.
And I think there can sometimes be a false reassurance in the herd mentality.
Yeah.
When I was at medical school, we were taught that one third, no, let me get this right, one third of drugs work one third of the time in one third of the people.
Mm.
So, you know,
Okay.
they
Check
can
that
work,
ratio.
but then, you know, it's about more than that. And it's about how we are with ourselves, what our mind-body connection is, what else can we explore? What do we, you know, do we get to know our bodies?
Yeah.
I
Yeah.
think, you know, as a medical doctor in the West, what I found before I did all sorts of other training was when you examine someone's body, you do
Yeah.
it very purposefully with a stethoscope, and you don't really realize, you know, that everyone's bodies are so different. And because I've done other kinds of medicine and all sorts of other things, when you actually start to work with bodies and muscles, and you feel everyone is completely different.
Yes.
So the unique individual, you have to kind of have a bespoke approach, which is not always easy to do when you're looking after 100 people, and you know, but you try and treat everyone as an individual because everyone has their own healing journey.
Everyone does have their healing journey, and I've even learned that everyone is different, especially from a cultural position.
Mm.
Um, myself, and I don't know if you concur with this, but myself, I've learned that me being of quote African or Native American descent, that our bodies respond differently to different types of medicine or even herbs as well. We respond differently because of our melanin concentrations.
That's
Um,
correct. There are
yeah.
some blood pressure medications that you would go for first in an Afro-Caribbean patient and in a Caucasian patient. You would take a different view on that particular medication. So you are absolutely right. But you know, my hair used to be very red, and it's just changed over the years. It's just got lighter and lighter. Just through the sun and swimming in the sea. But
Yeah.
an anaesthetist will often be reluctant to anesthetize a patient with red hair
Mm.
because apparently we bleed more than other people and have more complications. So,
Yeah.
you know, I mean, but that's a huge sort of general viewpoint. Again, as I keep saying, everyone's an individual. So yeah, you can have guidelines and you can have figures, but actually, your response may not be the same as your Afro-Caribbean neighbor, you know?
And I think it's unfortunate that here in Western medicine, we take a one size fits all approach.
Yeah.
Um,
But
to
that's the most economical approach if you think about it.
Yes,
I mean, it's
yeah,
different in the US, I believe, but in Britain, so Britain's made up of four countries: Scotland, England, Ireland, and Wales, just to get that right.
okay,
And that so we have a national health service which is struggling right now. I still work a little bit in the government national health service, but it's free at the point of delivery. All healthcare is free. But as medical needs expand and grow, I mean, that's really not possible to maintain. So
mm.
there's a real struggle now with how that's going to go because waiting lists are getting longer and longer and people are really not managing. But we've had the privilege of free healthcare since earlier on in the 19th century. So yeah,
Wow, okay,
20th
yeah,
century.
yeah, because we take the one size fits all approach, unless you go the alternative route, and we start getting into frequencies and vibrations of different people, and you're more into and you go into, even though you do prescribe standard medication to patients when it's necessary, um, you I even saw on your website that you create your own herbal remedies. Um, talk about how talk about how the frequencies or the vibrations, if you will, of herbs, how they or why they are so effective internally as opposed to standard synthetic medication. How do they differ when they enter into the body?
Well, I mean, often they don't differ. Like an aspirin, I can't remember what you call aspirin in the US. Is it
What's
Advil?
that? Well, Advil is just one type of aspirin.
Ibuprofen. Yeah, yeah. Okay.
Yeah,
So aspirin's
ibuprofen. Yeah.
the bark of a tree, and digoxin, which is a heart medication, is made from the foxglove. So many
Mm,
medications actually originate from herbs. I don't make my own herbs up myself.
okay.
We have herbal medicine at the clinic, and we also have homeopathic medicine. The two are quite different, so I'm not quite sure which of the two you were asking about there.
Just in general, how do herbs? How do they respond in the body as opposed to standard medication? I do know that there are, I guess, many, or I guess, yeah, most medicines do have trace amounts of herbs in them as a base.
Yeah,
Um, but as far as taking whole herbs as opposed to the medication, how do they work inside the body?
well, take something like hypericum or St. John's wort, which is thought to be
Mm,
good for depression and anxiety.
yeah.
Um, that can be given as a herb. I realize my accent is very different from yours when I say the word herb, but that can be given as a herb.
That's all
And
right.
that can also be given homeopathically. Okay.
Okay.
So what's the difference between those two? So if you give something as a herb, you're giving a quantity of a herb. Now there's a responsibility with that. You can't just randomly pick herbs and give them to people. Because
Yeah.
if you give somebody too much St. John's wort, you can actually induce liver failure and huge problems with the liver.
Yep.
So it's not a case of just going into the forest and grabbing a handful of herbs and eating them and thinking everything's going to.
Right. Yeah.
So herbal medicine has its own regulations and its own dosage like anything else.
Yeah.
I
Yeah.
guess it's purer because it doesn't have all the additives and it's not in tablet form and etc. etc.
Mm-hmm.
Um,
Mm-hmm.
homeopathic medicine is something different.
Okay.
Homeopathy, you mentioned frequency earlier, so we're kind of getting it all sort of mixed up in one bag here. So
Mm.
you have allopathic medicine, which is made by a pharmacy, very strictly regulated, and it has a certain amount of whatever drug. Now, that drug could be something that's made synthetically, or it could be something that's a natural product that's had other chemicals added.
Yeah.
And or then you could have herbal medicine, which is literally taking some herbs and making them into tinctures. You can not melt it down, but mix it with alcohol and a very small quantity of alcohol. Don't get excited there.
Yeah.
And
Yeah. Yeah. Yeah.
make it no whiskey, no bourbon.
Yeah. Right. Right.
Make it into a tincture,
A tincture.
and then
Yeah.
you can take the quantity of that herb, and there are different dilutions and different concentrations, but you're actually taking in a quantity of herb. And you have to be careful because these herbs can react in the body the same way as conventional or allopathic medicine can. And then you have homeopathic medicine, which is something entirely different. So homeopathy is about using a very, very, very dilute form of a substance, which
Right.
holds the frequency of that substance. Sometimes it can be less than almost something called Avogadro's number, which is less than can almost be detected. And you give that medicine so that the frequency of that medicine will kickstart the body into fixing the problem itself.
Mm-hmm.
A lot of doctors don't believe in homeopathy. They say it's nonsense. I trained in homeopathy
Ah.
and I've seen it work. It works best in animals and children because they don't have any preconceptions about it. But
Right.
homeopathic medicine is prescribable in Scotland, and it's actually even prescribable on the NHS. And we have a homeopathic hospital in Glasgow, which was funded by some very wealthy people. So it can't be knocked down or taken away or used for other prospects. So the homeopathic hospital still prescribes homeopathic medicine in Glasgow, which is quite unusual because in the UK, there's only one in Glasgow and one in Scotland. So
Hmm.
homeopathic medicine much more about frequency than
Mm.
the other two types of medicine. I hope that makes it clear. I hope you understand what I'm
Yeah, yeah,
saying.
yeah. Absolutely, absolutely. And another thing with standard medicine, and again, saw this on your website about how you listen more to the patient and what they need, or what it is that they're feeling, and some of their needs that or their even concerns about their health matters, as opposed to, again, here in the West, and I don't want to sound like I'm bashing Western medicine, but it's pretty much been a consensus that in allopathic medicine, especially here in the States, that many physicians don't take the time out to really listen to what their patients are telling them. They just listen to the symptom. Oh, I'm feeling this ache or pain here. And then the doctor, based on their teachings or their education, it's a prescription right away. And they're only in the office for maybe less than 2 to 3 minutes. Um,
Well,
why is it why is it that you have so many physicians that don't take the time, the quality time, to actually have this type of back and forth interaction with their patients?
well, I think that might be a little unfair to my colleagues. I think probably the biggest barrier to what you're saying is time.
Okay.
And because I don't for a minute believe, when I started medical school, you're all fresh-faced, you're out of school. It's slightly different in the UK because you go to medical school straight from high school. Whereas you guys, you take some time out, you do another degree usually, and then you do it. It's getting a bit more like that here.
Okay.
I think definitely I would recommend that you go out and do something else first before you do medicine, because you
Mm.
really need to know that you want to do it.
Yeah.
I do believe it's a vocation, and it's not for everyone. And but anyway, we started out, all of us fresh faced from high school, 19 years old, some of us 18,
Yeah.
and you want to do your best in the world. But when you get out of medical school, you realize it's not quite that straightforward, and there's no time to do anything, and it's a really
Yeah.
tough time of working when you don't have the resources you want, you don't have the time you want. There are a lot of sick people to look after, and you get given guidelines and you follow them, which is useful and good and safe. If you
Hmm.
get run over by a bus and you're in the emergency room, then you want the guidelines to be followed exactly to save you in
Of
the acute
course.
situation. But
Yeah.
often patients come and lay before you much more than just a sore arm or a sore leg, and
Yeah.
everything's connected anyway. It's back to the mind-body connection. It's back to looking after the whole person. So when I meet my new patients for the first time, I like at least an hour with them. I want to know all about
Oh,
them,
wow.
know who they are, where they came from, what makes them tick, what trauma they might have had in their life, and then we can build on that. And I
Yeah.
make that very clear. If a patient wants to come in and have something taken out of their finger, or their sore ear looked at, we can do that too. I have a wonderful nurse consultant who works with me, and I have other consultants who work with me too. So, it's whatever the patient wants, actually. But if I'm taking a new patient on my books, then I really want to spend an hour with them and find out what they want. Because even when I listen to them, I might think I know what they want, and I might think I know what I want to give them. But it's important to me. I ask this every single patient this question. Well, you've taken the time and the effort and the expense to come and see me. You've walked up the steps, past the flowers, into the foyer, into the clinic. And what did you come for, and what do you want to leave with? Because that's a really important question. Because
Hmm.
we all have our own reality.
Yeah.
And then what I think someone else might want or need is maybe not what they came for.
Yeah.
So I have a wonderful luxury of having an hour with a patient, and I love it because I really feel I get to know them well, and we start on a journey together. And I also make it clear that I believe healing is, how will I put this? It's a journey we make together. I think the old model of the pastoral care, of the paternalistic, and then laterally when women were allowed in, the maternalistic point of, come to me and I will anoint you and make you better. But
Yeah.
actually, For me, it's a shared journey. I say, look, I really want to help you. What do you want? And what can we do together to make this better? Because ultimately, a lot of things we can do to make ourselves better, they're free. You don't have to pay for them. You don't have to take pills for them. There are lots and lots of things you can do to improve your health. It's just about habit changing and learning to get back to where your body really wants to be.
Yeah. Yeah. And I'm glad that you have chosen to take that journey with them so they can feel like you're definitely included in their journey. You're included in their journey because they're bringing you into their world, back to healing. And 1 hour is definitely above and beyond what most physicians do here in the States, unless again you're in the alternative field, because many physicians they do go in to medical school with the greatest of intentions because they do want to
Yeah,
help. They do want to
absolutely.
help, and but once they go in, like you said, they have the certain guidelines, which are great, but at the same time, um, the patient the patient physician relationship isn't established. The relationship to where they feel comfortable enough with you to tell you all of their stuff, all of their stuff. For an hour, I mean, you can pretty much know their whole life story in an hour, you know. Um, so that's great that you take the time out to do that, you and your staff, which
Yeah.
you have a pretty big staff too. I was checking your
Yeah,
website
we're all a team.
out.
We're all a team. We're all a family. And yeah, I think we all love what we do. So I'm very, very honored to work alongside such fabulous people. And yeah, when I opened, I didn't know how it was going to go. My nurse consultant is amazing. We worked together for years. And I said to her, one day I'm going to open my dream clinic and will you come and work with me? And she smiled. I said, yeah, sure. And
Hmm.
then
Hmm.
10 years plus later, I phoned her up and I said, well, it's open. Are you going to come?
Ah,
So
right.
she's my right
Yes.
hand woman. She's absolutely fabulous. But everyone in the team is wonderful, and I'm really privileged to have had the chance to fulfill a dream that I've had. I'm not stopping now. I've got lots of other things I want to do too. So
Oh, absolutely. Absolutely. It never stops. And
yeah,
the dreams never stop either,
no, they don't. They don't.
So just
You
like
know,
a
it's
yeah, go
interesting
ahead.
what you were saying about spending an hour or not spending an hour because the family physician, so in the UK, the family physician, the doctor, well, in the old days, I wasn't around then. The
Okay.
doctor would live at the end of the street and they would just be there and patients would come and knock the door and present themselves. And in Scotland, you come and you say, oh, hello, I've got this, or Johnny's got this wrong with him. And the doctor would come out at all times of day or night and they would be rewarded with, some cooking or, you know, I don't know, an animal or yeah, I don't know, someone would come and clean the house or stoke the fire or do something in the old days. But you had the doctor who was a family, like a community member.
Yeah.
And that kind of carried on. And when I trained in the 90s, even then, we did our own on call right through the night. And so if a patient needed us, we would get our back and we would 2 o'clock in the morning, you would go to the high-rise flats or wherever you were and look after the patient. And you were the family doctor. And it's such a privilege to, look after people from the beginning of life to the end of life, and you would see generations of families, and it was really wonderful. I taught the medical school in Glasgow for 25 years, and I loved that. But it's changed now, and I think because of demand, and again the restrictions on time, you never see the same doctor at the clinic and
Yeah.
other clinics, and
Right.
it's a transaction. You're in for however many minutes, you see whoever's there, and then next time you see someone else. So that relationship, and even in the hospital, that relationship has changed because when I worked in the hospital, and really I'm not that old, when I worked in the hospital, you would not leave, whether it was 6 o'clock at night, 10 o'clock at night, midnight. You would not leave until everything was ready. All the blood bottles were ready to take blood for the next day. You would know it was the old Nightingale wards where the beds would come down in a row, and you would know all the patients, and you'd know all their relatives, and you'd know everyone, and that's what
Yes.
made the job so satisfying. But now, because of regulations, there's a lot of shift work, and I guess you could say that's maybe safer than working an entire weekend without much sleep.
Yeah,
But
yeah.
I lose that you lose the responsibility is perhaps not the right word. I don't know. You lose the togetherness, and you lose the camaraderie and the teamwork, because you don't really know who anyone is. It's just a patient who comes in your
Right.
bed. So it's very different now, even in the decades that I've been working. And
Wow.
I guess that's how it's had to move.
Yeah.
But in terms of job satisfaction, I loved being on the wards and knowing every single patient on the ward, and
Yeah.
knowing every single relative and who they were and what they were doing there. And you
Right.
know, I used to play in my first job. It was one of the most wonderful jobs. I had a fabulous professor, David George. He was an amazing surgeon, and he was so well thought of, and everyone he trained was just tip top. And I was the bottom of the rung, the most junior person in. And we had such fun, and we all stopped and had a cup of tea at a certain time of day, and it was all so nice. And then when I worked the weekends, there was an old piano or church organ or something downstairs. There was an old church anyway that nobody used, but the patients wanted to go down and have a Sunday service. So I would
Hmm.
find myself, I used to wear a white coat in those days with my stethoscope swinging out the pocket, and I'd be down sitting playing the piano and getting the patients all to sing. They'd all be coming with their drip stands, and they were so. I don't
Yeah.
think that sort of thing happens anymore.
Yeah. No, it really doesn't. It really
Yeah.
doesn't. Especially,
I knew, yeah, I knew who everybody was. I
okay.
knew everyone, and I knew who the relatives were, and they knew me and a little bit about me, and that you would never mess with a sister on the ward. She had everything shipshape, usually a she. I guess
Mhm.
it's all, it could be a charge nurse, a gentleman now, but yeah, it was very organized, and I collect some medical memorabilia. I have some old books that were written during the Second World War from one of the big hospitals in Glasgow, by one of the nurses there, and it was a journal, and there was a book about how to make chicken soup for your patients, and how
Mm.
to properly clean a wound and make it aseptic, and all these wonderful things that you don't seem to. It's different now. It's
Yeah.
different.
Yeah, it is very different now, especially what you just mentioned, which I'm going to go to right now because you mentioned the organ and playing. I have a music background in production and audio engineering. And so when I saw your bio about how musically inclined you are, and then I saw this piece on YouTube where you were playing the like an organ for your
It
for
was
the it was at the University of Stirling. I think that's what I
all
saw.
right.
This
Yeah,
was from
yeah,
a couple of years ago.
yeah.
Um, how do you incorporate singing? Because when I was watching the video and you were being interviewed by another lady, and while you were speaking, they had this angelic voice in the background. So I was like, what is that Dr. V singing with that voice? I'm
I
like,
love to sing.
whoa.
I love to sing. Singing's the thing that brings me most joy, I guess.
So how
Um,
do you incorporate singing into your practice as a healing remedy?
Okay, that's a big question. So I incorporate it both within my practice and out with my practice. So if you're talking about within my practice, the way, well, there's so many ways, but
Yeah.
our voice is our window to our emotions, actually. You cannot hide your emotion from your voice.
Yeah.
You know when someone sounds sad, you know when they sound happy. So it's got so much to do with our confidence. And I'm not just talking about singing here, I'm talking about the speaking voice.
Right.
But from a singing point of view, humans, before we began to speak, we communicated through sounds, through tonal sounds or singing. And so it's the most truest form of self-expression. And a lot of people would rather run down the street naked than actually stand up and sing a song by themselves.
Yeah.
And so, it's oh, you're screen sharing. What are you doing here? I don't quite. What are you going to show me?
So no, you can keep talking. I'm just
Oh,
this is
right, okay.
yeah.
So,
So yeah, go ahead, keep
so
talking.
yeah. So sometimes I do some vocal workshops with my patients, especially ones suffering from anxiety. Right. So, okay, here you see me doing some energy medicine. So this is a group of ladies. I run something called Singing Health, which is a charity.
Okay.
And I run workshops all over the place. We've made CD recordings. We've sung on the radio on Christmas Day. We flash mobbed a station in Utrecht in the Netherlands. So singing health is all about how singing is good for our health. And when we sing together, within a few minutes, our hearts start beating in synchrony.
Mm.
So there's nothing I like better than getting a group of people together and getting them to sing fun.
Yes.
It's
And
very off-putting looking at myself when I'm trying to talk to you. Nobody likes to see videos of themselves like that, but that was a fun one. And every week
yeah.
I run a class locally for charity, and actually I
Okay.
run it in the Dunblane Centre, which was founded after the Dunblane tragedy. And it's great. We have some men who attend as well, and I just encourage people to sing and be themselves. And the most beautiful sound is when someone is just singing from their heart without fear. And I help people to become relaxed. I do some energy moves. We do a little bit of movement. I teach them how to breathe correctly, and then we sing. And then I get to stand in front of all this wonderful frequency and vibration. So I get to receive it as I induce it and bring it out. So it's truly wonderful. And sometimes we put someone in the center, and then everyone will sing around them, and it's magical because singing is. Apart from it's the greatest offering we have, it's the truest expression of who we are. It gets all of our cells vibing high. It optimizes cellular health. It's got so many benefits, from cardiovascular benefits to getting all the happy hormones out, the endorphins from your brain. But it connects us to one another. Oxytocin is the hormone that
I was
new
going to ask
mums
you about that.
have
Yeah.
when their babies are born. So when we sing together, we start producing oxytocin, and we just spread the love. We just have greater love for our fellow humans, and we make the most beautiful noise. And that
Right.
frequency within that noise, I mean, what is singing? It's just using your body as an instrument to emit frequency. What is
Right.
frequency? Everything is energy and frequency. That's all there is. So you're making this beautiful, and harmony truly is harmony in every sense of the word. It's not just the notes that sound nice, but we're actually joining as one together. So you can see I'm getting very animated as I'm talking about this
No,
because
this is good. If
it's
it's your
my
passion,
favorite.
that's what you're supposed to do.
It's my passion,
Yeah.
absolutely. And sometimes I work up in the Shetland Islands, which is a glorious, most northern part of Scotland.
Right.
It's almost nearer Norway than it is Scotland.
Okay.
And we're on Spotify actually. We did a little recording to raise money for the MRI machine on the islands, and I just put an advert out in the paper and flew up there, and everyone came together and we sang some stuff, and it was brilliant. It's just brilliant.
Yeah.
So I get so much joy from it, and I get so much joy seeing everyone else open their hearts and be who they really are. So singing is a great form of healing.
It is a great form of healing. I learned that years ago, just being in certain music classes back when I was in my late teens and early 20s, when I was in college. This goes back to the early 90s. It didn't really hit me that it did have that effect, but I also know that it's like when you hear your favorite song on the radio, you feel something.
Yeah.
It creates a feeling internally.
Yes.
Which is great. And so with you intermixing that part of yourself in your practice and sharing that part of yourself with not only the people that are in your circle as far as your group and the charity and everything, but you also get to share that with your patients and show them that sound frequencies do have an effect on the body.
Yeah. So I have a piano in my consulting room. I actually am gathering more instruments as I go along because people bring me things, and I have one of my neighbors is a Sikh gentleman, and he brought me a special instrument from Pakistan. So I mean, it's fantastic. I had a patient who was really, really anxious about an impending operation. and she talked about her love of singing. So we did a little session together, and her husband was in the waiting area, and he said, "What's going on in there?" And she kept floating down the corridor, a new woman.
Hmm.
And I have a lot of clients in the movie and music industry,
Okay.
and some quite big names have come to see me, which has been an honor and very nice. And so one of them, who's very well known, sat down and started to play the piano, and then we both started to sing. And I thought, gosh, I never thought when I was studying at medical school and wondering if I should have done music that one day I'd be sitting in my own clinic singing with this person,
Yeah,
and
yeah.
my receptionist was at the front just asking me to stop.
Right, right, right. Yeah,
But it was fun, and yeah, we have community choir events in the clinic. Sometimes we just at Christmas we'll stand and sing some carols on the steps, bring the
yeah.
neighbours in, and there's a traffic line as everyone's trying to get home, and then they all stop and look. And yeah, it's great,
Mm.
spreading as much joy as possible. But frequency has been used to heal forever. I mean, in conventional medicine, a physiotherapist will use frequency in an ultrasound to, if you've got a bruise or an injury, a hematoma, you'll break that up with using a probe and a certain frequency with ultrasound. So there are lots of different frequencies. They just have a different value, and some we can hear and some we can't.
Yeah.
And singing is one we emit ourselves, but there are instruments that emit frequency that are used for healing too. And I have equipment that I use. Um, I work with the brain and the voice and the emotions, and I make frequency prescriptions for patients as well.
Every now and then I use something called the tuning fork.
Yeah,
Or the tuning forks, they have different frequencies.
yeah.
If I'd have known we were going this route with the conversation, I would have set them right here to tap a couple of them. But
Yeah, I've got some on my desk as well. Absolutely.
yeah, and a lot of people, again, these are modalities of healing that you rarely hear about in the mainstream, and they do work. They do
It,
work.
it's time we brought it all together.
Yes, yes, they do work. Sound frequency, music, harmonics, different different frequencies or vibrations of music, the entire musical scale. Do re mi da ba ba di da.
You
And
have a lovely voice.
and all of it matters because whether people know it or acknowledge it or not, all of us are a frequency, or all of us have our own harmonic. Like my voice is the way that it is on purpose. Your voice is the way that it is on purpose, and we all have different sound dynamics, voice dynamics. Um, and some people have in their clinics where they do voice detections on how people are feeling on the inside based on their voice,
Yeah, I do
uh,
that. Yeah,
biofeedbacks and things
yeah,
of that nature. Um,
yeah.
yeah, can you talk about that real quick and how that
Absolutely, I
works?
can. Yeah, I can. So in 2016, one of my close friends is a global music promoter, and he was in Brazil. Anyway, he phoned me and he said, you've got to get on this call." And I ended up being on a call with the president of Brazil's aide and him and a few other people talking about this frequency device. So the Zika virus was around in 2016 at the time of the
Oh God,
Olympics,
yes.
and they'd asked this scientist to come from Europe who was working with sound and frequency as a prescription to come and help eradicate and treat the Zika virus in the Olympic athletes. So I was listening to this saying, well, this is really up my street, tell me more. But I kind of put it in the drawer of magical things and carried on the conventional path with the other fringe things I was doing. And then a family member became quite unwell, and I thought, why am I not using this? So I went to Europe and he saw the clinician there, and was made a frequency prescription, and he returned to normal within a few weeks, and I thought this was really magical. And then I looked into it, and then I started going over there and learning more and more about it, and I have the program now, and I use it pretty successfully. I use it mostly for emotional disorders and mind-body connection.
Right.
I think for my license to start using it for lots of other things, I still have a conventional license, and
Yeah.
I want to keep it. So
Yeah. Yeah. Yeah.
I'm
Yeah.
just treading gently, and just working with what I have, and writing down studies, and I have lots of case histories to discuss to show people that it works. So yeah, it's exciting. I think that's the medicine of tomorrow. And I tell you something else that I didn't really realize until maybe 2, 3 years ago, as recently as that. So I play the piano, I play the violin, sing music, etc., etc. But I didn't realize that all of our energy centers, I don't know if you're familiar with the energy centers. So some
The
people
chakra
call them,
system.
yeah, the chakra system, but that
Yeah.
puts some people off because it's a bit woo-woo for some people. But
Yeah. Yeah.
they're also called energy centers. So the
Yeah.
first one, the second one, the third one, well, they're just the scale. So
That's
they're
right.
do, re, mi.
Yep.
So,
Yep.
why
Yep.
did I, with all the harmonics in between, why did we not work that out before?
Yep.
So
Yep.
it's so then I treated myself to some lovely sound bowls, and I run
Okay.
it's sort of sound medicine evenings once a month in my space. So I have a lovely yoga. Well, it's not just for yoga. I have a lovely mind, body, soul studio where we have yoga, we have Pilates, we have dance. I have a community cinema wall. We have sound medicine evenings. We have singing. We have stretching and breath work in there, so it's really great. And I have weekly drop-in meditations, which is a whole other thing to discuss. But I want to make it more of a sort of beacon of light, like a community center as well as a clinic.
Hmm.
Um, I didn't set out just to become a private physician. That was never my aim. My aim was to have a space where I could offer true, healing space with all the modalities that I learned about,
Mm.
um, and become the bridge between, joining that with the conventional medicine, which I know and love so well also.
Yeah.
So
Yeah.
I feel very fortunate. If you have a dream and you realize it, it's pretty amazing.
It
So
is.
I count myself as really lucky.
Yeah. Yeah. And it's a good segue because I want to talk about your clinic, Westbourne. Is that
Yeah.
correct? Westbourne Medical. Uh,
Studios.
Westbourne Medical
Westbourne Medical Studios.
Studios. There you go.
You got
Studios.
it. Yeah.
Yeah, Westbourne Medical Studios. Um, talk about uh, talk about that and why you felt that it was necessary for you to create it.
Okay. So, well, where let's start. So, the name. The
Okay.
name I picked because Westbourne was actually the school I attended, which is well shut down and gone now. And it was a very small, wonderful school in the West End of Glasgow, and it meant a lot to me. It was a really great foundation stone. So I wanted to name the clinic after something that made me feel strong and inspired. And medical had to be a word because it's obviously medical as well. And
Yeah.
studios, rather than calling it clinic or practice, I feel studios
Right.
because of music, because also you could have a sculpture studio, a studio is where you can be anything you want to be. You can create anything you
Yes.
want to be. So, we don't have a single red blood cell going around our body that we had 6 months ago. We've made brand new ones. So, our ability to heal and create new cells
Yeah.
is very much alive as long as we're alive.
Yeah.
So that's why I called it that. And I didn't even realize until I gave it that name that across from me are movie studios. And I have
Yeah.
a lot of people from the movie studios who come and see me, but I
Yeah.
felt it was necessary to create it. Well, it was more like a dream of mine to create it because I wanted my own space where I could, work within the system, regulated, obviously, but kind of have my own rules. And it matters to me very much, how each person feels when they come to the studios from the minute they see it with their eyes. We have beautiful flowers going up the steps, and beautiful old stone steps that are about 100. The building's about 170, 180 years old. So old stone steps, and you go up, and you have beautiful materials and lovely bright colors, fresh flowers everywhere. The smell is important. We always have music playing, funnily enough.
Mm-hmm.
So we're listening to, it could be jazz, it could be Bach, it could be anything. So it's in a very old building. Just you've got the
Now, this right here, this building, this entire building is Westbourne Medical Studios.
the lower
That
half.
that
Yeah,
the
the lower half.
lower half, because
Yeah,
I saw that there was 3 or 4 levels
yeah.
to the
Two
building.
levels we have. Yeah, we have
2
two levels.
levels belongs to you. Okay, okay. And when I'm looking, as everybody's going to get to see how tranquil it looks on the inside. I mean, look, you got the fireplace there, you got the kitchen, and the furniture and the fruit, and it's just an all encompassing dynamic kind of there you see I guess those are stones there, or jewels and things.
Oh, there's the toilet.
Yeah, right. You got everything there.
Yeah, the toilet, yes.
You got everything. But I think it's great that you made a choice to provide an all encompassing space for people to come in for virtually anything, no matter what their ailment is, or if they don't even have any ailments at all. If they just want to come in to refresh, or to just to re-energize themselves, whether they have an illness or not is irrelevant. Just to go there to be in a highly energetic space.
Yeah.
You
Oh,
know,
there's
and there's a piano. Yeah, I see that. But yeah, so I just like the entire surrounding there as we take a look at that. But yeah, that space, it just makes me want to get on a plane and come out there. I mean, yeah, because it just by the visual, it kind of takes you to a different space, and I guess that's the objective.
Yes, it is. It really matters to me. I'm very strict about how it looks and how it feels. And the ambience has to be right, the music has to be right, the smells have to be right. Um, people have to feel nurtured from the minute they come up the stairs. It's a sort of full sensory experience almost, because all these aesthetics count.
Yeah, they
I
do.
remember I have two lovely sons, and we were going out somewhere, and they were wearing scruffy shoes. And of course, being a mum, I said, "Can you not put some nice shoes on?" "Oh, mum, we're just going to the shops." I said, "But actually, what you wear, it's not about how other people see you, it's about how you honor your body." So they roll their eyes at that kind of chat, but they'll get it one day.
Right,
It's
right.
true. It's about, not keeping that good thing for tomorrow or a good occasion, but using it, wearing it, being it, feeling it, living it in that moment. And so I really want people to come upstairs. It's very important that they are the most important person in the room the minute they enter the door. The person in front of you, my girls always know, is the most important person, and they need to be heard and seen, and taken through and given a refreshment and sat by the fire until their appointment time comes up. And yeah, I think all these things really count, because when it's so busy, everything is so busy now, and so many times we feel like we're a number.
Yeah,
You can't get
yeah,
you on the phone
yeah.
with anyone anymore to speak about anything, or so I just want people to really feel seen and heard, and important and nurtured.
Yeah, because most people, whether it's here, Scotland, or anywhere on the planet, many, if not most people, are always in flight or fight or flight mode. They're always stressed
Yeah,
about something, even if it's
yeah,
getting up to go to work. They're already stressed.
yeah.
So coming to a place like your studio, and I'm glad you call it a studio, because I've been in music studios before, so I know what the feeling is to be inside of an actual music studio. And like you
Yeah,
said, the ambiance, it's almost like you don't want to leave once you get there.
yeah.
And I guess that's the objective too. You
Yeah,
know,
yeah.
you
People are
want people to have
welcome
that
to
feeling.
stay. Yes, they are welcome to stay. So, it's not unknown for us to go and get someone some lunch if they're around at lunchtime and they're a bit hungry or their appointment's gone on a bit. And yeah, there's a lovely little cafe around the corner. We get some fresh juices and some healthy food in. We're having a retreat day on this weekend. Just for a few hours, we're having like green smoothies and healthy lunch, and we're
Okay.
gonna energy medicine and some wonderful things. So we do fun things at the weekends. We do soul food Sundays where maybe 8 people will learn how to make an Asian dish or an Indian dal or something, and then we'll share it together. Or, talking about the importance of nourishment and good food. We have 2 fabulous nutritional therapists who are really amazing.
Mm,
And then other days we have meditation weekends, and it's just about being it's about being an example as well, and it's about being a beacon of light. I keep saying that. I don't mean to sound cheesy, but it's
yeah.
just about, look, it's okay that you know anything is possible really if we try.
Hmm.
And it's a health model I would love others to embrace, because there's no reason why we can't look at the whole person and walk with them to see them thriving and living a state of optimal health and well-being.
And you mentioned nutrition as we get ready to wrap up here. You mentioned nutrition and how we can boost the immune system, especially for travel purposes. Um, just real quick, how important is nutrition just from a general position, whether you're going to travel or not? Because I know that some people, when you travel and you hear certain things, oh, you have to boost up on this to go to this country because this country have these diseases or this country has these diseases, and you have to boost up your immune system. Um, how important is nutritional health just for overall daily living?
Oh, it's of primary importance. I mean, at medical school, we only get maybe a day's lecture on food and nutrition, and I've done a wonderful nutrition course. I just could believe how little I knew when I did this course, because
Right.
we are not only what we eat, but we are what we absorb. And
Right.
our gut flora, our gut microbiome is our gut garden, if you like. And
Yes.
it's connected to the brain and to mood
Yes.
and
Yes.
everything. It's to our complete well-being. So we have to make sure that the bacteria, we are more bacteria than we are human. We are walking bacterial hotels.
Yep.
And so we have to make sure that our gut is happy and that we have the right balance of bacteria to keep us alive. Because if we don't, then we can't stay alive. So what we eat and what we feed them is of paramount importance.
Yeah.
And I think the processed foods and all that, yeah, let's not get political about that. But we
We can
need
save
to,
that for next time.
yeah, we'll save that for next time. But nutrition is crucially important. Why don't I just say that?
It is crucially important. I mean, I have my smoothie right here that I, have with me, and because most of us, again, and I can only speak on here in the States because that's where I live. Um, Most people here are nutrient deficient,
Hmm.
and which is why many of the illnesses that we have exist because of nutritional deficiencies. Um, Whatever, and we can talk about the vitamin B and C and D vitamins and the minerals all the mineral content of the magnesium, the calcium, and all these things that we need. Um, Most of the time, that's what's missing in our bodies. And the friendly flora is something that's highly overlooked. We have these candida overgrowths in our gut, and which is overlooked as well.
Hmm.
So I'm glad you mentioned gut health, gut
Yeah,
health, because
yeah.
it's so important and it's so overlooked because we deplete our friendly flora. I call it friendly flora or the friendly bacteria, because of all the processed food that we eat day after day after day after day after day for years. I mean, sometimes from childhood on into our adulthood, and we can't really fathom why we have all these aches and pains, and I've developed arthritis, and I have diabetes, and my vision is going bad. My joints are aching. Um,
But
all these
these are
different things.
reversible. If we make the changes, we can reverse that.
Right. So, real quick, can you give us just some simple, just maybe a remedy or two that we can maybe apply um, for, let's say, for vision. Let's say for
Well,
vision.
so that's an interesting question because everyone says, oh, yes, well, carrots help you see at night. So your beta carotene helps with vision. But it's not so much about take this for that, take this for this. I would say the importance of eating locally and eating seasonally is crucial because
Yes.
we can just have strawberries whenever we want them. Now, Scotland actually has some of the most delicious strawberries in the world, but they're only around for about a week.
Right.
Just the
Right.
amount of stuff we get. So, you know what? We have to eat according to where we live and we have to eat according to the seasons.
That's right.
So, and that way our body adapts. So we should try and have rainbow in everything. But eating, I would say if you want one phrase, it's eat according to where we live and eat according to the seasons. And our body will adapt and use everything correctly for everything that we need.
Yeah. Because the body knows. Unfortunately, we don't we take the body for granted.
Mhm.
We don't really realize how magical, literally how magical the human body is. We think that it's deaf, dumb, and blind. The body's too stupid to know how to heal itself on its own when we give it the correct fuel.
Yeah.
You can't put diesel fuel in an economy car because it won't work. You have to put the right fuel in our bodies, and like you said, according to where you live and the seasons, because where we live, of course, we're closer to the equator, so we get a little more sunlight, as opposed to where you are. You're a little further north to the North
Yeah.
Pole.
So we get more oily fish.
Right. Yes.
Yeah. Yeah.
Now, I'm glad you.
It's already worked out for us. We just have to
Right.
see it and eat it.
And eat it. Right. And eat it. And because the fish is great for you. I love fish. I love my salmon and all these different great fish that are in the waters that we have. And I'm glad you brought that up because it is important. Nutrition is important. Um, Gut health is important. And you mentioned oxytocin earlier, and all the because mental health is a big problem here in the States. So many people are complaining about having daily anxiety, daily depression. Um, Again, I don't know how it is in Scotland with mental health, but here it's been a major deal. Um, Real quick, what can we do to make our mental health a little better?
Well, that's a very open question. Depends how many minutes I have.
Okay,
I
go
think
ahead.
one of the most important things for our mental health is human connection.
Okay.
Connecting with one another, with our hearts, being together, supporting one another. Isolation is one of the worst things for anyone's mental health.
Mm,
Um, we'll just skim over the COVID time, which has been so difficult for so many.
right.
Um, Human connection and the power of community is probably the number one fixer.
Yeah.
Then we're looking at a whole list of other things. Sleep. Sleep is
Oh,
essential.
that's huge.
Yeah, because if we don't sleep, so when we sleep, our brain goes through, it gets one or two, it should get full rinses. There's a fluid that goes around the brain and the spinal cord called CSF, cerebrospinal fluid. And it
Mm,
circulates right round. It's like a vascular supply. Instead of blood, though, it's this fluid that goes round our brains, down the spine and back up. And we have a rinse. Our brains get like a car wash rinse while we're sleeping.
mm,
And that's when it detoxifies. So if we're not sleeping, our brain is overactive. It's not becoming clean, I suppose.
yeah.
And then we don't make the neurotransmitters, which are the chemicals that send the messages from one part of the brain to the next. And one of the main neurotransmitters responsible for mood. Well, there are many. One is called dopamine. One is called
Right.
serotonin. And there are other two called GABA and acetylcholine, and these are the four main neurotransmitters that help with our mood and our emotions. So we need to keep them healthy, and there are lots of good foods that we can eat to keep them healthy too. So that's a very big question. What can we do for mental health? I mean, I could talk for hours about breathing and meditation and back to singing again.
Yeah,
I don't think we have that long this time.
Yeah. No, everything that you mentioned is great, and just that little bit alone is more than enough just to get started. And Dr. V,
I ask every one of my patients the question, and some of them are a bit fazed by it, but I ask every single one, what brings you joy? Because we need to find what we're here for, what our purpose is, what brings us joy in our hearts. And if we find that out and follow that, then mental health is pretty healthy.
Yeah, you can definitely minimize all the depression and anxiety. Find your joy, the inner joy.
Yeah.
Not the happiness from the outside world and what that can bring you, but the inner joy, the inner bliss, the inner harmony.
Yeah.
The inner harmony. Dr. V, thank you so much for taking the time out because I know it's getting later and later out there. So thank you for taking the time out. Tell everyone where we can find you.
You're so welcome. Thank you so much for having me on your lovely show. You can find me in Glasgow in Scotland. You can find me at westbournemedicalstudios.com. You can find me at Singing Health. We're on Facebook. We're on the socials. We're everywhere.
You're everywhere.
If you connect with me, I'd love to hear from you.
Yeah.
And I'd love to meet some of you. Come and visit. Scotland's a great place to visit.
Yes. I definitely want to make it something on my bucket list to go there. Because I've heard a lot about Scotland over the years, specifically Glasgow, and and I just from your website you can see all the different ways of building structures that are there that are very different from here in the States, obviously. So yeah, definitely that. So definitely check her out, Dr. Veronica McBurnie, Westbourne Medical Studios. Check her out. It's always great. Dr. V, thank you so much. And to everyone listening, absolutely. Thank you for listening and watching. To everyone tuning in, there's 1,000 podcasts that you can be listening to. So thank you for tuning in to the Kinetic Hour. And we thank Dr. V for coming along for the ride. And until next time.